Hi, Miss Lopez. My name is Jasmine. I will be your nurse today. What brings you in today?
I'm having blurred vision. My head's constantly hurting, and I have this like pain right here in this like right region of my like where my
Okay.
baby is.
Okay. And when did your symptoms begin?
It started this past week.
This past week.
Yeah.
Okay. And were you doing anything in particular, or?
I was just showering. It wasn't anything like crazy that I was
Okay.
doing.
No injuries or anything that you're aware of?
No.
Okay. And then I do see, let's see, you are 35 years old. I do see that you are pregnant and you're expecting. How far along are you?
I'm 32 weeks.
32 weeks, and everything's been healthy so far within the pregnancy?
Yeah, so far just this last week has been rough.
Okay, I'm sorry to hear that. Okay, so let's see. And then are you having any swelling within your hands or feet?
Just my hands and feet, but I thought it was normal due to pregnancy.
Okay, okay. And then how are you managing your headaches? Have you taken any pain medication
I
or
take Tylenol.
Tylenol? And has that been helping relieve the pain?
Yeah, it like takes most of the pain away. I still like have like a small lingering headache afterwards, but better than
Okay. Okay. So I'm gonna go ahead and are you still feeling the baby move?
Not as much, but
Not as much. Okay. Okay, so I'm going to go ahead and check your vitals. We'll check your vitals, we'll check baby's heart rate, make sure everything is still okay. So I'm going to have you go ahead and lie back. You would lie back. I'm going to check your blood pressure, your heart rate, your oxygen level, your temperature, and make sure everything's good. Dun, dun, dun. Okay, heart rate is 85. Your oxygen levels 98%. Your respirations are 14, and your blood pressure is a little elevated. I did get a reading of 180 over 100. So with all the symptoms that you're experiencing and your high blood pressure, you may be experiencing something called preeclampsia. It is a condition that pregnant women do get. What some of the factors are your age. Sometimes, is this your first pregnancy or have you had previous?
No,
do you have other children? First, okay. So it can happen with the first or consecutive pregnancies, but you do fit the over 35 or 35 years. And then this can happen after 20 weeks of gestation up to 6 weeks after you have the baby. So the most important thing, we do want to manage your blood pressure and your symptoms because the preeclampsia does cause the arteries to dilate and it does affect the uterine growth for the baby. So if this gets worse, we may have to induce you or do an emergency C-section, which we want to avoid. But because this can be fatal to you and the baby, we do want to get your blood pressure well controlled, so we don't have to go that route. So what we're going to do right now is we're going to go ahead and administer nifedipine. Nifedipine is a medication to help control your blood pressure. You didn't mention that you were having any contractions. Are you experiencing any contractions?
No, not that I can feel.
No? Okay, good. That's good. Okay, so we're going to go ahead and give you the nifedipine. We'll continue to monitor your blood pressure, continue to monitor the baby's heart rate. We're checking the baby's heart rate. Heart rate is good. Heart rate is at 149. So that is those are good signs. So we'll go ahead and get this started and we'll go from there and we will continue to monitor. If you have any questions, just let us know. And I'd be more than happy to assist you in getting your questions answered.
Okay, thank you.
You're welcome.